Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning into the Tate Chronicles. Join me as we explore the leading edge of healthcare innovation. My guest today is Travis Leonardi, the CEO and founder of SOS Technologies. Travis brings a unique perspective to the intersection of health, safety, and technology. SOS has developed SmartSOS, which is a fully integrated threat management platform. Travis, welcome to the Tate Chronicles.
Thanks for having me. Thank you.
Could you, at least initially, at a very high level, Travis, describe what the SmartSOS platform is and what problem is it really fundamentally designed to address for the healthcare community? What is the SmartSOS platform?
Yeah, sure. So if you look at the industry and how it works, and especially in the hospitals, and I'm acquaintedly I've been intimate with the hospital setting and how it works and how their safety and security is provided. And it's all fragmented, like many, many other buildings throughout the United States. But healthcare, or hospitals more specifically, are a sweet spot for me because if you look at workplace violence, and we'll talk about workplace violence at great extent here on this conversation, because 73% of all workplace violence occurs in hospitals. 73%. So it got my attention, and I'm saying to myself, okay, before I decided to actually get into the industry and provide integrated platform technology, I looked at hospitals and healthcare because it's near and dear to my heart, and I wanted to see if we could make an impact. So I created the company with the mindset of improving the environment associated with healthcare employees that has now become the number one issue when looking for a job. Nurses and other floor staff on med-surg floors, EDs, psych units, their number one requirement is, what do you have now in place for workplace safety? Salary's great. We need it. We need health insurance. We need all those things. But their number one issue now in HR has risen to workplace safety. So that's why I got into the business of providing a platform service that integrates all the fragmented technologies, everything from cameras to AI to lanyards to buttons to interactive data between law enforcement and the location. All these things combined need smart and intelligent technology as well as humans to make sure that if there is an event, to try and prevent the event first, and then secondarily, if the event is underway and ongoing, to make sure that the system is set up in such a way where if a nurse knows that there is a issue, and when we use a nurse, it could be anybody on the floor, as you know. A nurse hits the button, she knows that within 5 seconds, she's got security on site to defuse the situation or apprehend the suspect. That was the reasoning behind it. Go ahead.
No, I was going to say, one thing, just as you're talking, Travis, that really strikes me is that healthcare facilities, whether it's a clinic or a hospital, those are totally open environments. There's no metal detectors. There's no body checking bags or anything. By nature, they have to be open. And so
they're all soft targets.
Exactly. But so that kind of leads me to the next question based on information you have and research you've done. What type of threats are we discussing? Like, we're not really talking, for the most part, terrorist threats. They're most likely somebody who's unhappy about something or upset. I mean, what are these threats?
You're 100% correct. Well, there's three basic areas that you'll see the threats, and by former patients, and the families of those people, right?
Exactly. Yep.
So you see them largely and one of these are new. You'll see them largely, and we have hospitals that are using the buttons 2-3 times a day, because that's what they have. They have security buttons, and then they have the police buttons, and they're using it 3 times a day in these specific areas. One is in the psych units, as you might expect, right?
Sure.
And it's largely the patients causing the workplace violence and their physical attacks, fighting. They're trying to hurt the caregivers on the unit.
Okay. Sure.
And then you have ED, where people get frustrated. They're sick. They're not feeling well. They're sitting in the waiting room for, let's say, a half hour, and then they become irate, and the same syndrome occurs where they become physically aggressive and hurt staff. And when we say hurt staff, and we say workplace violence, we're talking about something that has happened to an individual working at a location in a hospital that has lost days of work because of the violence that occurred. And lastly, it's in the building department, if you can believe it. It's people coming in to yell and scream. Yeah, and this is a new evolution in people in hospitals resorting to physical violence over issues in healthcare. So that's those are where the 3 places are: physical violence. We're talking about workplace violence,
Sure.
And then sometimes when you have people coming in, they also have weapons, right? So weapons technology detection is really important to prevent the incident, especially if there's cameras in these EDs, which there are, and especially on the psych units. So, weapons detection, it doesn't have to be a gun. It could be a knife. It
Absolutely.
could be, a little club. It could be anything. So,
Well, let me tell you, Travis, I've had one experience that really had to do with kind of a severe threat. I was working at a large pulmonary practice. Half a block away was a cardiology practice. And during lunch, we heard 3 loud bangs. Somebody had walked in to confer with the cardiologist. There's somebody in their family had died. They wanted to follow up with the cardiologist. They killed him and barricaded themselves in the room. So we heard those 3
my
bangs,
gosh.
but it was over 10 to maybe 15 minutes before we heard the sirens. And this person was in there with a gun barricaded. And so I guess, my question is, how do traditional security approaches fall short?
Okay, so individuals can't be everywhere at the same time, right? And their eyes can't be everywhere at the same time, even if they're on location. So let me just take a step back.
Good.
It's the vision of the company is to create a world where advanced technology and real-time intelligence work seamlessly to prevent threats, right, before they arise, and to reduce first responders times from minutes to seconds.
Okay.
And we do that through, I call them the 4 pillars of protection. Prevention, right? We detect unwanted visitors, weapons, intruders, and threatening situations. Integration, our platform integrates with all the video feeds, floor plans inside the hospital, secondary means of egress, other entry points, door lock, magnetic control lockdowns, PA systems, smartphones, other IoT devices. And, the AI threat detection system is in place. So the system identifies what's happening as opposed to relying on an individual, which is largely what hospitals do at this present time, is, security guards. And there's a finite number of security guards. And the bigger the footprint of the hospital, the more people you have to have, and the locations of where, the threatening points are, have to be considered through, one of the things we do is we do an evaluation on work plan. Where should the security guard stay? Right. When the button is hit, how long, what's our tolerance to get the security guard to that location? Let's say it's in the ED. The security guard should never be more than 2-3 seconds away from getting into that ED or that psych unit to get to the nurse so she can protect her and apprehend the perpetrator of violence. So that's the issue. The issue is it's all done by people. They have surveillance cameras, but who's looking at the surveillance cameras?
Right.
If you don't have technology like ours to actually be, smart technology that's constantly looking for, let's say, facial identification, they can deploy that. Weapons detection.
Sure.
Altercation technology, right? Altercation. There's something going on. Button wasn't hit. Lanyard wasn't hit. Altercation on the AI through the camera sees it's happening. That triggers the event as well. So no people are even involved in certain circumstances, depending on what the hospital wants or needs. But that detection of altercation is key, right? What's happening? Nobody hit a button, but we see it. The AI detected it, and the security guards could be rushing in. And if it needs to escalate, security guards can hit the police button. And the key there is you can't wait. Go ahead.
No, go ahead. Right, you can't wait.
Okay, so we have the prevention, integration, empowerment, right? We provide the first responders with real-time updates, including video streaming and floor plans and door access controls. Access control is a big deal. Lock it down. Don't let any other people that are outside that might want to jump in on it to come into the building. And then acceleration through the CAD integration that we have in major cities in the United States. That removes the need for somebody to be talking on the phone, because it's trusted, it's reliable, and knows specifically why that button was hit, where it's got to go. And our technology will send the information. It's happening in the ED, give the police a floor plan of the ED, and that information is immediately triggers within seconds first responders. Obviously, they're in a hospital, so police are going to be the number one. If it's a situation where they hit a certain button that's active shooter, let's say, God forbid, there's somebody brings a gun into it. It sends a different protocol, different message. Where is he? How's he moving through the hospital? We're using geolocation devices to follow this guy throughout the hospital until the police can apprehend him. So significantly different than how technology, which is fragmented and non-unified and still relies on people, to automate the whole thing, fully integrated, communicating with police, bi-directional, interoperable, and it brings people on scene to be able to, stop the violence and stop the shooting.
Travis, are you primarily focused on hospitals and hospital systems? Is that your primary?
Not primary. It's one of my primary ones because I guess it's near and dear to me. But it's there's a lot of protections needed in a lot of places, like the school systems and government buildings.
Oh, absolutely.
And, office buildings. It's happening everywhere now. So we're going to provide it to anybody who's sensitive to it. Go ahead.
We're kind of in a period now where certainly threats are not increasing, but also expanding. The idea that a CEO of a major health insurance company would be assassinated on the street, walking to a conference, would be unthought of 5 years ago. I'm kind of surprised there hasn't been a attack on a large pharmaceutical company yet. I mean,
all of these are targets.
Yeah, absolutely. Give me an example. If let's say just a scenario, it's the emergency department of a hospital, somebody rushes in, or something happens and somebody pulls a gun out. And somebody has a lanyard or a button to push, or in an ideal scenario, how would that work? Yeah,
I gotcha. Yeah. So an ideal scenario, they would have AI connected to their cameras, which we provide, and that also they would have lanyards and hard mounted, alert buttons. One probably to internal security, one directly to police.
Okay.
And what would happen is, as the person walked in with the gun, the AI would have picked it up within milliseconds and triggered an alert. And it's all configurable by the hospital. And if they wanted to go to internal security first to check and say, okay, the AI, let's make sure it's a gun, we're going to hit the 911, not the direct connection to the CAD or police. And we're going to hit that button right away. Or they can have an automatic relay from the actual AI specifically going to the CAD interface, which dispatches police immediately. So, or, again, I'm giving you all the scenarios, right?
Yeah.
Or, so that's AI, which they should have. I mean, I don't understand it when some of the some of the people that we talk to and do implementations and sell a PaaS, platform as a service system, they don't use the AI. They're like, we don't need that. We don't need the camera. But that's prevention, right? You want to prevent these things from happening. You don't want to react to these things if you don't have to. And if we're reacting to it, they didn't get the AI, then they would have the appropriate lanyards with internal security, police, and also have button technology as well as message boards and lockdowns and however else they wanted to configure it to make sure that they isolate this shooter in a place where the cops can apprehend them immediately. And, like you said before, it was 15 minutes, you said, I think, that you heard the sirens?
Uh-huh.
Yeah, yep. That's the issue. 911 was never set up for situations that needed second response. You can't they have to respond in seconds. What happens in 1 minute with an individual with a semi-automatic weapon? What happens in 1 minute? He's got a lot of time to hurt a lot of different people. So you can't say 15 minutes is enough. It's not because they're not coming as fast as they can, but if there's a 911 phone call or some of our competitors are out there, they say, we're 911 connected. That's a phone call. They're using services that have a phone call to 911, which you could have done yourself as well.
Yeah.
It's craziness to talk about minutes when seconds count. And that was the key. The key was for me to prevent the incident and to get that response down from minutes to seconds.
Let me mention for a second to our audience, if you just joined us, I'm Jim Tate, and on this edition of the Tate Chronicles, I'm speaking with Travis Leonardi of SOS Technologies. Travis, let me ask you another question that's kind of popped up for me a little bit. I understand that you're the integration from your side, but from the first responder side, how do they need to integrate with you so they could receive not only messages, but, floor plans, things like that?
Right. So every police department that controls a 911 dispatch service has what they call a computer-assisted dispatch system.
Oh, I didn't know that.
And in order for us, and that's the key. So it takes away the human connection between the 911 operator and the dispatch officer.
Okay.
And so what we did is we bypassed all the human components and then sent the information directly into the CAD system, where it's then presented immediately or it's alerted to the officer to be dispatched to that location, sending them the information we just sent. That's the key. The key is to be integrated to dispatch, not to 911.
And so it's kind of, in some 911 scenarios, I've seen somebody calls that number, says there's a active threat here, and they notify everybody, and it's the fire department that shows up first, which is which is it's good to have them there.
Yeah,
but that's not necessarily who you want there first.
That's correct. It's so. Excuse me.
Yep.
We communicate to both. And we specifically send messages to both because many of the major cities now, and even local municipalities, the EMS, EMT, ambulance services are all coordinated and run by paramedics, which are under the veil of fire department, right? But in a hospital, probably not the best way to get first responders on the scene. So you have to make sure you separate the fire from act of violence or active shooter or a situation that needs law enforcement or even something heavier, SWAT. It depends on the setting and how the system's been configured and what technology they have decided to integrate into their hospital. So you're right, it is an issue. I talked to somebody yesterday about it in DC. And it's an interesting scenario on how these things operate and how people communicate. And you would think that different cities, let's say LA, for example, right? The LA has an issue and they need an immediate response. How is paramedics communicating with law enforcement to make sure that they're on location at the same time or close to the same time? And how do they both know what's going on? I'm providing that information to first responders in real time so they know exactly where they have to go and what they have to do. And who goes, who's priority, right? We have an active shooter. We don't want firemen being killed. My father was a New York City firefighter.
Mm-hmm.
The last thing we want to do is throw a firefighter into an active shooter situation.
When you begin a integration with a hospital or hospital system, I guess your initial thing is to do an assessment or due diligence of where they are and then your recommendations.
Correct.
And then do you supply hardware and software across the board?
Yeah, they don't need software. We provide platform as a service, so nothing is on premise except for the buttons and some hub technology and some network technology that doesn't rely on Wi-Fi. It all works off of cellular connectivity, along with 900 megahertz to 1500 megahertz technology. So you don't have to worry about Wi-Fi going down, which it does.
Exactly. Yeah. Here's kind of a question. If I was running a hospital and installed your system, how would I test it without worrying the police department?
Yeah. So you're asking me when you go live with it, is there a testing plan that goes accepted?
Well, like a fire drill.
100%.
A fire drill.
Yeah. So, and there's testing, there's teaching of the staff. Everybody knows what to do, how to do it, what button to hit, when to hit it. The AI picks it up. They're understanding what's going on with that. And then you go through a whole testing cycle. You don't go to a live system right away. It's all part of the implementation and go live. And then we have a test and acceptance. Everybody's trained, everybody knows what to do, and we'll run through scenarios like they're happening, not really happening, but, make believe, mock occurrences.
Sure.
And the hospital will know how each one of those things happen and how they respond. We even have technology that once the information is sent to police, that the notification comes back to not just the hospital, but any location where it's saying the message has been sent, police are on the way. And they know that for sure, 100%. And then if the hospital has message boards, they can put things up on the message boards to staff, code blue, code red, different things, so that the rest of the building knows something's going on in the ED or the psych unit or the billing department.
Yes.
So it's making sure everybody understands that something's happening, where it's happening, and what they're supposed to be doing and what protocols they're supposed to be following. 100%, though, you're right. You have to test it.
And so you mentioned the ED again. So if there's some threat, something's going on in the ED, I guess right now, at some point, somebody gets on the intercom and says, we're locking the hospital down or something like that. What about, internal messaging?
The system actually can do that. The system can do that. It can send everybody an alert on their phones through either text messages or emails. It could be a sounding of the message board. These are things happen automatically. These aren't triggered by human beings. They're triggered by the system's integrated technology. So all these things are working in concert with each other to provide a safety net over where the occurrence is happening in the building.
So this instant notification can be not only to first responders, but literally to anybody.
And it does. Generally, they want to see the alerts on their phones.
Yeah.
You know how you get an emergency alert now? Let's say a storm is coming or something like that.
Exactly.
It's what do they call it? The Amber Alert, where
there's a silver alert
for on the highway.
Yep.
Right. We make sure that we get priority alerts out to anybody in the building that's on the list of people to be notified. Again, it all depends on how the hospital wants to roll out the system.
Travis, I would imagine that some of your biggest cheerleaders are first responders who've utilized the system.
Yep. Yeah. Yes. The police departments that we work with love the ability to get real-time information as quickly as possible that they can act upon, and they can get there quickly on site. They love it.
Well, for our listeners today who really want to learn more detail about the SmartSOS platform, what's the best way to find out more about your services and maybe schedule a demo or presentation? How do they get in touch, Travis?
Sure. Yeah. So going to the website in the top right-hand corner, go to www.sos-tech.com. And you could schedule a presentation with one of our sales staff.
Is that an online presentation?
It could be online. It could be remote. It could be, it could be whatever the folks are looking for on the other side. But generally, the first encounter is, hey, let's talk to you about what we do, what the presentation looks like, how we do it, and then we can increase the steps as time goes on.
Well, great.
With the location.
Well, unfortunately, we're almost totally out of time. To our audience, thanks for joining me on this episode of the Tate Chronicles. I offer a special salute to my guest today, Travis Leonardi of SOS Technologies. You can find more information on this show's program page at healthcarenowradio.com. That's healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.